welcome to Dialogue with Khuraira. If you are new to this platform, Dialogue with Khuraira is a platform created to showcase what we call the unsung heroes. Who are the unsung heroes? These are individuals doing great things in their various communities for the betterment of humanity. And we bring them so that they can share their stories. Hopefully they will inspire you, motivate you to start something also positive in your community. So together we can uplift the lives of others, one person at a time. So I thank you all for joining us, and happy 2024. It's been a great 2023. And we are honestly grateful to many of the unsung heroes that joined us. We've gotten great comments from our viewers saying that they have learned from so many of you. So we thank you. Without you, there wouldn't be Dialogue with Khuraira. So we appreciate you, not just because of you coming here to share your story, but also the fact that you're using this inspire others and also to go out there. I've gotten people that actually had come directly to say, please, can you connect me with this person? I heard what he's doing or what she's doing. I love it. And I'm hoping that they are reaching out to you guys. And we also made it a point whereby we will be start putting your contact information by your bios, so that way people can also reach out to you directly. So I thank you all for making 2023 an amazing year. And I have to say thank you to my show programmer, Rufai Bello. He's been incredible, very smart young man, doing great things. I thank you. I hope you had a wonderful new year, and we are ready to make it happen and inspire many other people for 2024. So today we have a guest. Her name is Hajiyya Badiya Magaji Inuwa. She has a foundation, a sickle cells foundation. And if anyone that knows me, you know that sickle cells is very personal to me, because I nearly lost my son, my youngest, Hanif, from this dreadful disease, sickle cells. But thank God, Hanif is a survivor through bone marrow transplant, and now he is in the pre-med in Harvard University, whereby when he was really sick, we were told that he had a 20% chance of survival. So if you see me maybe even tearing, you wouldn't blame me. But if you even hear the story of Hajiyya Badiya and what inspired her to start this foundation, you will understand why the two of us are very passionate about this dreadful disease. So thank you, welcome, post comment, and make it interactive. Hajiyya Badiya, welcome to Dialogue with Khuraira.
Hello, welcome.
Happy New Year. Happy New Year.
Same to you, and happily in advance in areas also.
So this is what I do. It's like you introduce yourself, tell our audience your story, and then after you're done with your introduction, then I will ask some questions, and maybe some viewers as well will post some comment so that you can address it. So welcome, Hajiyya Badiya. I can't believe we've been talking. I think how many years, Kena, we've been talking. I know.
We've been talking about it, yes.
And finally, I'm seeing you face to face.
Yes, we can see each other now.
yes. So welcome. So Allah, just introduce yourself and we start. Thank you so much.
Okay, thank you so. Assalamu alaikum. My name is Badiya Magaji Inuwa, and I'm the founder of the Sickle Cell Patient Health Promotion Center, Kaduna, Nigeria.
So, Hajiyya Badiya, I know you're very shy, you don't want, but can you walk us through what inspired you to start your foundation? You know, people see certain people do certain things, but they don't know what drove them to start that. If you could share your story, if you don't mind, with our audience, that would be great.
Okay. Actually, I'm a mother of two sicklers. One is late now, and the other one is surviving 45-year-old. And what inspired me to start this foundation was not knowing 5 years, 5 months before my son died, we were admitted in a private hospital. Mm-hmm. At the private hospital, I came down to escort some visitors who came to visit us. So outside the veranda, I saw a woman holding a 2-year-old child. She was crying. She looks like a less privileged anyway. Yeah. So I went and escorted my visitors. Then I came in. I saw her talking to a cleaner in the hospital. So I asked the cleaner what was wrong. She said the woman cannot pay her hospital fee for admission. So that's why they couldn't do anything to help her. That's why she was going. So what I believe was the cleaner is a neighbor to the woman, and she told her she's working at one clinic. Yeah. I believe that's why the woman went to the clinic. Okay. So on going upstairs to meet my son, who was a bit better that day, I told him, I'm not happy. I saw a lady, the child was so bad. I wish they did something to help her or to suppress her worries or to help to suppress the child's crisis. But they told her they can't do anything. So the woman went out crying. So the next day I went down again and asked the cleaner, I said, how was your neighbor? She said, thank God she has been admitted at one of the hospitals in Kaduna. Then I said, thank God. So on the second day, when I saw her again, I said, how was the child? She said, the child is normal. All was normal. I felt bad. So I went back to my son. I said, Isa, because Isa was my eldest son. He died at the age of 35. That was about 18 years ago now. So I told him, I said, look, Isa, you are better now. Do you know that child died? I wish they helped the woman to suppress her worries and also to suppress the child's pain. Mm-hmm. So what are we going to do after I leave the hospital? Then we started talking. I said, I think it's time we do something to help the less privileged. Yeah. Then when we were discharged, we started talking. He said he will check his computer and find if there is anything online that we can do. Then an idea came to my mind. I said, why can't we ask close friends, relatives, and so on, get some money, we go and buy some drips, the things that I know sicklers need anytime they rush them to the hospital, and some medication. So we started. The first month we went to one government hospital, then I told them if any less privileged came with the problem of finance, please attend to them. Instead of you insisting they must go and bring admission money or something like that, do start using the drugs and the drips and everything that you can start with the only less privileged. They were grateful and they took it. We did it first month, second month, and by the third month, Isa was admitted in the hospital. When he was admitted, Isa gave up. So I felt bad, but all the same, because I never showed God that I'm tired of what was going on about Isa's case. So I just took courage. So one day, just about 5 months after his death, I was sleeping. I wanted to go to the bathroom. So suddenly something just bumped inside me. I felt as if God wanted me to do this, because I remembered that if I wanted us to have less privilege in the society. So I wrote my biro and booklet, I wrote a note so that I don't forget in the morning. So in the morning, I started thinking. Then I told one or two of my friends, I say, this was what I discussed with my friend before he died, and now it's normal. What can you think I can do? They say you can do it. You have the courage, because even at the hospital, anytime he is admitted, you don't feel, you go and crying by the bedside, but you will have the courage to be comforted. I told my husband, I told many of my friends, they say you can do it. So that was the beginning. I started writing application. I got my ESCO members, board of directors, of trustees. All this I started within 8 months. When I sent my application to Abuja, I got registered. So I got registered, no place to start, no patients. So an idea came to my mind. I said, why don't I send all these side hospitals in Kaduna? Let me take my exercise book. I will ask the head nurse to write any first 10 scholars that came for admission or they came for treatment, their number and their address. In 2 weeks' time, I promise I will come and collect my books. So I was able to get about 76 patients. Then again, I said that is not enough. Anyway, before then, I said that I rented a block where I will start the clinic as an office. So I have to pay for the rent, and then we started. That time I had only 2 officers. I got a staff nurse and I got an admin officer. Then the booklet, I started checking that I intended to have about 100 people that are sickless, whom I will take care of forever until my last breath or something like that. Yeah. So I asked them to be registering. I asked the media, one of these radio houses that was in the TV. I can't remember that it's the TV or NPA. I asked them to advertise for me. Yeah. That there's Twitter, because our aims and objectives, I asked my staff that we have to give them free medication to suppress, routine drugs, to suppress their crisis anytime or to stop the crisis coming. And then also awareness. We intended to go around schools, government, private, also. We did that. We started thinking of doing that. So by the time we started registering the patients, they were coming every day. They are coming every time for registration. So my staff will say, Mama, see, it's above the number you said you are going to do. I said, no, don't worry. We intended to do it. And inshallah, Allah will help us to do it. So we kept on. Before, when we started, we are the ones that taken the blood samples, the genotype test, the photograph, because they have to give me 2 photographs, one for the file with their lab test, confirm that they are really sickless, and the other one is for their hand cut, their next appointment. We write it. When we give them the medication, and when we know when they are going to come back, that is after every 4 weeks. So that's how we started doing. Then we started going around to the schools or to these local areas. We sent to the Ungwa, who is I don't know how. So we used to ask, write letter that we are coming. We should get some parents, both women and male, that we are coming to talk to them about sickle cell, because we realize this sickle cell, especially in the north, we realize there are more sicklers in the north than the other side, because our northern people, we know they have more than one wife, most of them. So if by any chance they happen to have if by any chance the husband is a carrier and he has about 3 wives, 2 are carriers, so maybe we are not good. Only God can do what He wants, but at least out of those, maybe the other women, they will have syphilis in their own among the children. So we started thinking. I go on radio, television, everywhere. I'm there, newspapers, and I'm so glad and grateful to all these media houses and journalists, because they are very interested in what we are doing. So they kept on doing it for free for us also. So at the end, the number was going up, 1,000, 2,000, getting to about 3,000. So that time when it was at over 1,000, we could not take the blood sample, we could not do the test for them for free. And the medication was okay. But the photograph, that was the only thing, that is the only thing we are only asking them to bring up to date. 16 years ago, we have been doing it.
Wow.
Yes. And every month, they have to come for their routine drugs. We used to go for house-to-house visitation, so that make sure they are taking their drugs regularly. From the beginning, not many of them. So many people, that time, they don't care. They say, it's God willing, I shouldn't worry. I think, as I say, no. So we kept going. If we go to a house, before we go to a house, we have their telephone, we have their house number. I will send one of my staff to go and check find the place. So we just drop the following day, all of us will go. We are about 16 in number, my staff. So you go there and I ask, where is the small bag? I gave you medication. About 5 drugs we are giving them to supportive drugs. It's not to cure the sickness, but it supports them because many of them, when they brought them from the beginning, they will be looking emaciated and very sick and ill. It's very sad the way we used to see them. But if I insist they must come in for 4 weeks to collect their drugs, honestly, before 3 months, they are all picked up. So we are always happy about that. So how to get the drugs? I used to write to friends, my children's friends, my relations, some organizations. I'll write a letter. I have all the list of the drugs killers who are supposed to be taken to suppress their crisis or to suppress the crisis coming. So I know exactly what it was. So I write the list of the drugs. When I wrote it, I will give you if you want. We prefer the drugs more than the money. But many people say, no, we don't have time to go and get the drugs. This is the money, go and buy it yourself. Because no matter what, I must see everybody, no matter how many of them come to the clinic, everyone monthly, they will get their 5 types of drugs, which is very, it's challenging anyway, but somehow able to make it up to the up to date. That's exactly, there was no day, whether there is public holiday or no public holiday. If it's the clinic day, every staff must be at the clinic. So there was a day when they said it's only one day between these 16 years. It was only one day that is a clinic day, and we didn't attend. That was when our former governor, Rufai, said that nobody should go out because of this corona, you know.
Okay.
COVID, that COVID. He said that nobody should come out. I insisted. I said, you must come. It's a clinic. What you should realize, all these our patients, they are less privileged in society. If they spend their money coming down to the clinic to come collect their money, and they saw the clinic closed, they don't have the money back, and they don't have the drugs. So they even if
I'm sure he empathized with you because he also has family members that have sickle cell, so he can understand your plight, you know.
They did understand, but all the same, the only thing I will appreciate much about his time was when I wrote a letter to the assembly, Kaduna State. I said, please, they should not let anybody get married without testing their genotype. So for 6 good years, any day we have sickle cell, annually if we have sickle cell day, I will turn my face to the representative of the governor or the representative of the commissioner of health. I send the message to me. Yes, from me to whoever.
So they were able to pass that.
Yes, I'll pass the message.
So wonderful. Well, hold that thought, Hajiyya Badiya, because we have Dr. Qasim, who is, I don't know if he lost light, but you know, at this junction, we want to bring in an expert.
Yeah, sorry, I lost light, but
Dr. Qasim, how are you?
It's back now.
How are you, sir? Yes. So, you know, why I said that this is the junction we will bring.
I changed my location. We lost light, but I'm in a place where there's light now.
Okay, so you have to like have your camera. Your camera is a little bit up. So if you could make it so we can see your entire face.
Okay, now.
Yeah. So welcome, sir. Welcome. So you know, Hajiyya Badiya is started her foundation out of necessity. Out of Hajiyya, my heart, you know, just bled for you because I know how it felt when my son was in an ICU, and when the doctors looked at us and told us that he is the sickest child in that hospital, and he had a 20% chance of survival. We were saying, please God, save our son. And for me to see that my son survived, and you're hearing you saying that after you discuss all this with your son, and then he got sick again, and he went back to the hospital, but he's not here, makes me like really thank God for having mine, and I'm sorry for your loss. But I think your son purpose in life is what you're doing, because just to hear that you are helping thousands amazed me. I was actually thinking you're going to tell me like 20, 25, but thousands. Well, you said something very important, which is, I think, might help a lot, because sickle cells is a hereditary, but we're going to have the doctor to explain everything for us and how it can be controlled, being hearing from an expert. You know, for us, Hajiyya Badiya and I, we just happen to be passionate about it because our family members were affected by it. So we don't have the expertise to educate the public about how it is gotten, how it can be prevented, and many others. So Dr. Kashim, if you could just help us and educate the audience on that, that would be great. Welcome, sir.
Thank you very much. I have actually been touched by the stories that you shared with us. And I'm not surprised, because that is typical of what sickle cell disease is. Because whoever has a patient, a child, a brother or sister that has sickle cell disease, you hear similar stories or even more touching stories than the ones you have shared. It's the same story over and over again. Yeah. And when we meet with colleagues in conferences, it's the same story from every part of the world. And that is why thank God for the increase in awareness because of the media houses, social media platforms that have been involved. And of course, we can see that there is increase in awareness of what sickle cell disease is all about. The myths and misconceptions about sickle cell disease is improving.
Yeah.
So because of the increase in awareness, advocacy about what the disease is all about, how it is contracted, and what are the ways of prevention, how do we take care of our patients with this disease, among others.
Yeah.
So, but I think it's still good that we share light on how do we get sickle cell disease, because there are still myths and misconceptions about sickle cell disease.
Yes.
Because if we are in the cities, we assume that everybody is aware of this. But whenever we have radio programs, you keep hearing questions that are associated with a lot of myths and misconceptions. Yes. It means that there's still more to do about advocacy on sickle cell disease. True. And so as a way of introduction, for the sake of our brothers and sisters that might not be fully aware of what sickle cell disease is. Sickle cell disease, as my sister highlighted, is an inherited disease due to inheritance of an abnormal hemoglobin from both parents. And that abnormal hemoglobin, at least one of them is a sickle hemoglobin. Hemoglobin is a red pigment that is the major content of our red blood cells. So we have different type of blood cells. The more important one is called red blood cell. And that is why the color of our blood is red. What gives the color of our blood is that hemoglobin, which is a red pigment or protein that carries oxygen, transported to other parts of the body. Now, what carries out this function is hemoglobin, and is a protein that is inherited from both parents. Just like we know, we inherit every trait or character in our body from our two parents, our mothers and our fathers. Now, both father and mother contributes to what we are really made up of. Now, our hemoglobins are a contribution from both our parents, mother and father. Now, sickle cell disease is a disease due to inheritance of abnormal hemoglobin from both parents. And this hemoglobin is called sickle hemoglobin. And that is why the disease is also named after that, sickle cell disease. Now, because hemoglobin carries oxygen and transported to other part of the body, now people with sickle cell disease have problem with these functions. And because it's an inherited disease, it means that there is contribution from both the mother and the father. And that is very, very important because of so many cases, myths and misconceptions that are in our society. You found out a family that the mother is divorcee, and she has so many children that are sickle cell disease. And this is just due to a mere fact that the society believes that it is the mother that gives these children the disease, not knowing that it's a contribution from both the parents.
Yeah.
Because the mother herself alone cannot make a child to be a sickle cell disease child. It means that there must be contribution of father and the mother. And that is why premarital hemoglobin testing or genotype is advocated before marriage, known as premarital screening, as part of the premarital screening, in addition to the viral screening, the HIV, hepatitis, blood group. And that is why we also test for electrophoresis, hemoglobin electrophoresis, or commonly known as genotype. This is to help us know whether there is possibility of the spouses contributing to having a child with sickle cell disease. And that is most important way of preventing sickle cell disease. From the word go, before marriage, there is premarital screening, so that once there is chances of the two spouses having a child with sickle cell disease, they should be properly counseled about what is the possibility of them having a child with this disease and what are the burdens and consequences that are associated with bearing a child with this type. Just as our mother just rightly gave a story of her family. And as we said, it's a similar story in most families.
Yeah.
In fact, some are actually stories that you cannot forget.
Yeah.
Very touching, very emotional stories.
I had a friend who had
yes,
sickle cells, and she had 7 children, and all 7 children had sickle cells.
Can see.
She will be in admission, and she lived in Kaduna. She will be in admission in one room, 3 of her children in the other room.
To be in the other room.
You know, I really want to quickly.
Yes.
I'm glad you're explaining this, and people are understanding that it's not people a lot. The reason why it's rampant, especially in the villages, because people are afraid to say that they have their carriers, because automatically they are looked at as there is something wrong with them, so they hide it. I have a friend now that her son has AS, and they already told them, and they went and did a test, and the parents of the girl brought the test and said the girl is AA, because an AS cannot marry an AS because there's a so literally the parents went and lied, and the doctor who did that, it's a heinous. So now they have a child. That child is suffering from sickle cells. So, Doc, what can we, with that case, whereby you guys are the good doctors are advocating for all this, educating them when they come to the clinic, and then the government are doing their part to pass a law. The religious leaders are also doing their part, saying that we're not going to marry you out if you don't give us the certificate. Then how can we control what can be done with someone like this kind of doctor that lied? Because if the parent lied about if the doctor did not connive with the parents of the girl, my friend's son wouldn't have been having a child now with sickle cells.
With sickle cell disease, of course.
You know?
And
so thank you for raising this. But the truth of the matter is, whatever is happening is just to show you what the society is actually made up of. That is what I always say. If we are all trustworthy, we are all honest, then that is what we found in every strata, in every aspect of our lives, and in every part of our society, in the hospitals, in the mosques, in the churches, in the market, and in our houses. So it all turns back to societal upbringing and the trustworthiness that is lacking in the society. And that is why they say charity begins at home.
Yeah.
So I think in terms of that, there are regulatory bodies that if we have this kind of cases, we can report to, and they will investigate and take proper actions.
Especially
for us in medicine,
the doctor, because obviously that is not the first time he's doing it, and he's not going to stop.
yes,
I have another thing to tell you about this.
Right?
Okay.
Hajiyya Badiya, is that not the case?
That is one.
Mm-hmm.
That is one. Two, I advise people doing this test to go for reputable centers, recognized centers to do this test, not just any shop that is just by the roadside, and they just put a signboard and they are running tests like that. Most of these shops or centers we see along roadsides are not actually recognized diagnostic centers. And that is, in fact, most of the people there parade themselves as doctors or laboratory scientists, which are not actually are.
And also
that is what we say. So for all we know, the people we refer to as doctors might not be actually doctors. That's the truth of the matter.
Okay.
They are just after.
So
they are just
this
after.
can be done by anybody.
Yes,
no. That is why I'm advising or saying that people should go to reputable diagnostic centers to carry out this test.
Okay.
Preferably specialist hospitals or teaching hospitals. But these problems, usually you see them in private settings, usually. And that is why we said private settings are just after making money. They are not after the quality of the results they issue to the patients. Most private centers are after making money.
Yeah.
They don't bother about what they give out to the patients. The quality control issues that you have to make sure that you have a standard quality assurance procedures, that you make sure that the results you give are actually standard, and you compare them with a reference standard before you even validate the results you issue.
So maybe,
this is usually,
even apart from them going to these hospitals, I was telling my friend, next time your children, go with your daughter and this other, and be there looking and doing it. No more telling them to send you theirs. And if they even do it, you should take the girl or the boy to your own doctor or whoever and get it done. Because even if they do the test, you should also, as a parent, take it upon yourself. Because I have to tell you, this disease is not a joke. It destroys families.
It's a reality. It's a reality.
When my son was sick, we were all sick in that house. I mean, emotionally, mentally, physically, we were all depressed. He had two older siblings that never got any attention because all our focus was how we can save him. And I'm sure Hajiyya Badiya would like
the same story. The same story.
I have two experiences with my patients.
Yeah.
There was a girl, she was a sickler throughout. The mother knew since she was 6 months she was a sickler. So they were admitted in one of the hospitals here. I will not name the hospital. So at the laboratory, the lab attendants of the lab, the lab technicians, sometimes they were the ones that are making the mistakes. Because you can imagine one hospital is not only sickle cell. Sometimes this lab technician, they will test about 50 tests of blood per day. Imagine one person doing it. Sometimes they'll just draw the blood without writing the name on the bottle, to identify which paper is for this result. So that girl, she went for the test, and there was a boy also, he went for the test. When they brought his own is not sickle cell. It wasn't sickle cell. So I think he was ill, he just went there. But incidentally, they had the test at the same time. So the technician made mistake and put the result of that sickler on top of that boy's paper. People were there waiting to see the doctor. They had this boy rolling, shouting, crying that he's not a sickler.
Oh.
Then the mother, likely enough, the mother of the child was about the girl was about 16 that time. The mother said, "What they all came? What was wrong? What was wrong?" Then he said he is not a sickler. He has never been a sickler. Then the doctor came out of the room. He said, "What is going on?" They said, "This boy is not a sickler, but his results showed he's a sickler." And this girl, the result was AA. The mother insisted she knew her child was a sickler from the age of 6 months. So the doctor insisted they must all go back to the laboratory for another test.
Can you imagine?
Yes, after again. So they
thank God the doctor was able to, I mean, the young man was.
Yeah, he used his common sense. He said, "Okay, let them go."
You know?
And then after just few months after, I sent some of my sicklers, because sometimes from the bigger hospital, they send them to our clinic because they are less privileged, so that they will be getting the free medication. So they send them from Baroduko. About 2-3 people, they send them to my clinic. So I say, I don't take patient just like that and start giving medication. I must get a laboratory test result, because we are not a medical doctor. By profession, I'm a teacher. So in case medical personnel come to visit my clinic, they see so many people sitting, they will ask me, "Are they all sickless?" I say, "How do we know?" So I'll convince them. I say, "Don't you think I will appear stupid?" Then they say, "Yes, ma'am, yes." I say, "I will go and do it another one. Our file is our file. Your result for coming to be a patient at our clinic, I must have the result. If there's any mistake in future, it's not my fault. It's the laboratory that you went for the test." 3 times. So at the end of the day, I send my pharmacist. I said, "Please go to that laboratory, that hospital. Ask them what is going on." Then she called me from there. The man said, and I was not. I said, "Just he wants to see me." So he came to me. To the clinic. Then I said, he's an elderly person. So I said, "Baba, please be honest with me. Be honest with your God. Tell me, how do you get your reagent for the test?
Yeah.
How do you get it?" So he mentioned one tribe that I were supplying. I said, "So what is the consistency of the reagent to test and make sure it's for sickle cell?" You know, sickle cell is the most difficult thing to test, because if you make the slightest mistake, you are in trouble. Then he said, "Actually, sometimes if they brought this, let's say it's supposed to be 90, something drops. Let's say, it's an example he was giving me. If the person brings it and it is about 85, he will collect it. Or if it's 95, he will collect it." I say, "My God." I said, "To the best thing, me, I'm not going to expose you, your hospital. I will not. But please, from now onwards, if anybody come and you know the reagent is not the correct one, please just tell them that the reagent for the testing is finished. They should go to another lab."
Yeah. So exactly what Dr. Kasim is saying. It's all about
from the lab.
About making money to them.
Yes, and then recent one, the most shocking one, a girl's father, they knew about sickle cell. They say the girl is AS, and the boy has to go and go for the test. The boy took his friend. The boy knew he was AAS. He brought a friend that is AA. They went to the laboratory. The lab man wouldn't mind what the name of the person, the patient, so. He asked his friends to give them the blood, but the lab technician, he doesn't know what was going on. At the end of the day, they got married and God catch them because the first child was a sickler. He came out as a sickler. So what is all this rubbish?
That's what happened to my friend's son too. So Dr. Kasim, you heard Hajiyya Badiya's dilemma, which is trying her best to do right. He is professional. She even said she
Yes.
cannot. I'm telling you, she is the one that made me to find a doctor. She said, Khuraira, I'm more than happy to come and share my story, but I am not going to speak and make a mistake because I'm not a medical doctor. And I reached out to Dr. Hassan and say, please, my guest is not showing up until I find a medical doctor. So, and I'm so glad that she is. I didn't even understand Hajiyya Badiya to the extent of what you're dealing with. So, with all this that she mentioned now, we have now somebody who carries his friend. So, can they look at ask for the ID?
It was after they finally found out what was happening. What happened?
So, in that case, Dr. Kasim, how do we go? How do you advise parents to handle this?
I think it still goes back to the first advice for people to identify a reputable diagnostic center to do their test from. Because if you look at it, just last week, Saturday, I went for a wedding. Yeah. And it was during the wedding that the leaders in the mosque were trying to ask if there is any doctor around to interpret this premarital testing for the two intending couples.
During the wedding?
During the wedding.
They don't know, no awareness.
You understand? So I was just confused. And you know, the society, the way you think, the way you think and the way they think is actually different. Do you understand? So sometimes we also find ourselves in a very difficult situation to really carry people along, make them understand why they are supposed to do what they are supposed to do before even this time.
Yeah.
And this one, sickle cell disease is just one aspect of this premarital testing. Yeah. And this will affect the family. In fact, we have seen families that you can see the father and the mother fighting in the clinic. You can see marital disharmony obviously outside. So if only people know the kind of situation they are really subjecting themselves after marriage and getting children, having children with sickle cell disease, they wouldn't have done the lies, all these lies, just to marry.
Yeah.
Because people actually don't know.
I think is the really breaking the stigma. I think the number one thing is breaking the stigma, because people with sickle cells are so shamed, you know. They are called all sorts of names, and like you said, because I am obviously I have AS, so all my life I knew I'm AS. But my my late husband, the father of the boy that had the transplant, when we got married, there was nothing, because he plays sport, he's healthy, I never seen him sick, so we never even tested. It was not thinking, because also we're in America, we had done all the tests, there's nothing else, but we never thought of this. I never even thought of the sickle cells to do the test, the screening on that. Until when I have twin boys before Hanif. So when I went to do what is that testing after 4 months, they test to see. That was when we found out he was also a carrier. At that time, we were educated, they sat us, we were given a counselor telling us this. They say, okay, we pray when these kids come, we're not going to find out until we have the twins before we know if they have sickle cells or not. Thank God I had the twins, Jamil and Camille, didn't have the sickle cells. And Hanif. So, with my head growing up in Nigeria as well, doctor, they'll just lie. I swear to God, I'm in this country, but my mentality was like this, because that is what I grew up being told. That all this thing that doctors are saying is, I didn't believe them. But I was told when the counselor sat us down, that she said, there is a 25% chance one of your children will have sickle cells because both of you have AS. I also thought, after I finish this, I need you to break down, the different genotypes and what are the percentage, so people can understand the frequency of how you can really have one of your children, two of your children, or your entire children having it. I think we need to educate people on that. So when we had Hanif was perfectly healthy 6 months. Before 6 months, I told my husband, see these doctors, I told you, they don't know what they're talking about. Here in the US, they do a test that comes back after 6 weeks. It comes with your blood result. That is when we were told Hanif had sickle cells. That day was like the end of the world for me. But even at that time, I did not believe that Hanif really had the sickle cells, because he wasn't sick until the day, maybe a week after his 6th month. Since then, every month we must go to the emergency because of the crisis. And that before that happened, the doctor told me the reason why he is not sick within this 6 months, because he has your blood still.
Yes.
His neonatal blood. So for that reason, he's not going to have any sickness. So I want you to discuss that, sir. And I also want you to give them the idea of saving the umbilical blood, because in terms of transplant on what, later with those, that if one of your child gets it, because I was educated on that, but I don't want to talk about it because you are the doctor. So if you could, like, literally, Hajiyya Badiya, after for what we went through with our children, we could be doctors of sickle cells.
Yes, of course.
But still, we don't want to mislead we want the doctor to talk.
With our people here, most of them, they don't believe in genotype testing, checking on before marriage. So that's my reason why, right about 10 years ago, I asked Pastor Buru, as a Christian, to represent the Christian people, and Sheikh Hajiyya, we always go for our advocacy. If we are going anywhere, we go together. Let them emphasize that even in the holy books, we were asked to check the health of everyone before we get into marriage, to keep the family healthy. So I always go anywhere we are going to advocate for sickle cell. I will go with Pastor Buru and Sheikh Hajiyya.
Wonderful.
So, and it helps. And during, like, Ramadan, when it is time for this tafsir, I write letter to Rusul, Sheikh Ahmed Gumi. I write a letter. I will ask them to say something about sickle cell. Being a doctor also, I will tell him to please help us to say something about sickle cell. And the testing blood doesn't mean anything. God will not be angry with them. It's supposed to be so. So that was how we are doing our own. So I believe one day people will get used to it, because at the time, there was a time I insisted that every parent should understand that. But without the awareness, nobody, all this village is only, the thing is happening in Kaduna, only in the cities. Outside, no, nobody. I even mentioned, if I'm having some interviews, I say everywhere now, even in the villages, there is radio. They can understand. Let's, like me, I have ideas. Let's make some jingles.
Hajiyya Badiya, let's give Dr. Kasim a moment to run down what genotype testing is. What if you are ASAS? What is if you are AAAA? What is if you are AASSS? What are the chances? And please, sir.
Learning by experience is actually something that you can never forget. So, and it's not surprising that the stories you give will be totally different from stories other parents will give that do not have children with sickle cell disease, or that don't have first-hand experience.
That's exactly what I was telling Hajiyya Badiya when she said, no, I said, Hajiyya Badiya, you have no clue. What you will share will touch people more. But I think, sir, you doing the breakdown of all this so that they can understand that just because you are AS doesn't mean that you won't have a child with sickle cells. And then the gravity of you marrying SS and SS, that one you should be firing squat on you. So please, explain to them, let them understand, because it's very important. It comes from you as a professional doctor than me and her.
Thank you very much. Thank you very much. I think it will be much easier maybe if we have a background knowledge of how inheritance is all about.
Okay.
It follows what is usually called in biology Mendelian pattern of inheritance, meaning that the inheritance of whatever character, be it the color of our skin, how tall or short we are, how intelligent we are, whatever thing, physical or functional trait or character we have in our body is a combination of what we inherited from our parents, both our mothers and fathers.
Yeah.
And this material that carry this characteristic are called genetic material or genes.
Okay.
And as the goat will have it, they always occur in pairs. Why they occur in pairs is because we inherit one from mother and the other one from the father.
Okay.
And a combination of two genes or a pair of genes is actually what is responsible for what we have at the end of the day, which is called phenotype.
Okay.
Now, in terms of hemoglobin, the normal hemoglobin is called adult hemoglobin or A hemoglobin. It's designated as hemoglobin A. So if somebody is completely normal, he must have inherited hemoglobin A gene from the mother and another hemoglobin A gene from the father.
Okay.
That is when an individual is tagged as AA.
Okay.
Somebody having a genotype of AA means that he inherited hemoglobin A gene from the father and the other A from the mother.
Okay.
That is how a normal pattern of inheritance is. Now, if the father and mother are carriers, meaning that they are AS, they have combination of normal and abnormal hemoglobins.
Okay.
This is what is referred to as carrier state or carriers.
Okay.
Now, if the father and mother or the intending couples are actually carriers, it means that a father can either donate the normal A hemoglobin or the abnormal S hemoglobin in the formation of a child.
Okay.
And the same way for the mother. So the fear now is, what is the chance of a child becoming a sickle cell anemia child if the father and the mother are carriers? And this is what is being explained by the Mendelian pattern of inheritance.
Okay.
So, and the possibilities is that the father will either contribute the normal or the abnormal hemoglobin, and you have 4 different chances or possibilities. If you combine and permutate the possibilities, you see that if the father, for example, contributes the normal hemoglobin, the mother can contribute either the normal and the child will be AA, or the abnormal and the child will be AS. In the same way, a similar way, if the father contributes the S gene and the mother contributes A, the child will still be AS.
Yeah.
And if the father contributes the S and the other contributes her own S, it means there will be what? SS hemoglobin. That is sickle cell anemia.
Yeah.
So if we look at these 4 possibilities,
Yeah.
we see that there is 1 or 25%, if we take it as a percentage,
Yeah.
there is 25% chance of the child having AA hemoglobin and 50% chance of the child becoming a carrier AS and 25% chance that the child will be SS. That is in terms of percentage, or in a simpler way.
Okay.
Since there are 4 possibilities,
Yeah.
1 out of these 4 will be AA, 2 out of these 4 will be AS, which is carrier state, and 1 out of 4 will be a sickle cell anemia child. Now, it is as simple as it is. Maybe you would have drawn something to make it clearer, but I think it's maybe too late now.
No, very simple. Very simple.
I hope it is clear.
Yeah, to me, it's, and that's exactly what they told me. They said your next, you're lucky these 2 didn't have it, but hopefully your next child it does. But there might be a chance 25% will be AS or 25% SS. I mean,
Yes. So
yeah, exactly. AA,
so
I'm sorry, SAS. Oh no, SS.
yeah,
And the other
yeah,
one, yeah.
yeah.
Um, but
So
how reckless would it be for someone
yes.
knowing that they are SS, fully knowing they're SS, and then they know maybe because the family they are related, or maybe they are prominent people, they must marry into that family, and decide to go and marry what do you call it, an SS.
It's ignorant.
So you know what is actually obtainable in the medical profession is that you as a doctor, you are there, you have a role,
Mm-hmm.
but it is important to know that your role is also limited to some extent.
Okay.
And your role is to make sure that the intending couples fully understand what it means to marry if both of you are carriers or even one of you is a sickle cell disease individual or client.
Mm.
So all you need to do is to make sure that you explain to them how is the possibility of their children going to be, and what are the burden or the difficulties associated with caring for children with sickle cell disease. Now, if you have done your best and make sure that they have fully understand this, now you leave them to take a decision. If they so wish that despite being uh, uh, in a state of fully understanding this, but they still feel that, yes, they love one another to the extent that they rather bear the consequences of this rather than to separate. Fine and good. You have done your role, and you have done your best to make them understand. You can't prevent them from doing that. And this can only be done by enacting laws in that society, which is actually beyond your boundaries.
Yeah.
Because, yes, this can only be done by legislation. You are legislators in combination or in collaboration with judicial arms of
Yeah.
the society. And if they so wish and they enacted laws that give guidelines, fine and good. You are also not part of the people that will make sure or trying to enforce this in the society. All you do is to advise what is supposed to be done, how people are supposed to behave, what is advisable or what is not advisable. Now, if people will understand this and will fully understand, not just understand, I believe majority of people will not go ahead and get married despite having these possibilities of having children with sickle cell disease.
Yeah.
Now, what people don't actually know is that it's only when you see a parent or a child that has the disease and you have seen the type of pains, the kind of pains they go through, and the difficulties and a lot of psychosocial problems that are associated with these families, that you can only know that, yes, this thing is actually a reality.
Mm.
And if you see the kind of suffering that these individuals go through, you will not wish your worst enemy to be in this kind of condition.
Yeah. True.
One of our patients was describing the pain. She said it's just like having a knife and be cutting her flesh, be just cutting her in pieces. That's how she explains the pains.
Mm.
Some of them will explain that it's just like they are being thrown into burning fire.
Yeah.
That's how they feel the pain. A lot of descriptions from these patients will make you feel,
Oh yeah.
yes, that this thing is not actually a joke.
No.
And
No.
one of our colleagues was narrating to us that there was a child that is usually having crisis in and out of the hospital.
Mm.
And at one point in time, he was in severe pains and he looked at his parents and said that if they knew that there is possibility of getting birth to a child like him, he will not pardon them.
One also.
Yes. So if a child will even think, because until I listened to that story, I have never imagined somebody thinking in that way at all. Yes. But
so
what will make somebody to think in this way?
Yeah.
Of course, the suffering
should be actually an extreme kind of agony, pain, and suffering that will make somebody to think that way. And I actually know of a couple that are actually educated, well educated. They knew their status, but because they loved one another, they went ahead and married. But if you see the suffering, they just had one child that is sickle cell disease child. But I can tell you the suffering that the family is subjected to, the whole family, is something that is actually pathetic. Very, very pathetic.
All the same.
Yes. So I think if people know this and examples that is similar to this, which you always hear from parents and people that have experience to this, I think people will really change their mind, even if hitherto they have intention of still going ahead and getting married. So what I'm trying to say is that as a medical doctor or a professional in the hospital, you have a limit to what you can do.
Yeah.
And the highest thing you can do is to make sure that people understand what the disease is all about, how the disease is contracted, what are the burdens, and what are the psychosocial factors, the suffering that the patient himself or herself is subjected to, his own family and other relations together.
Yeah. Yeah.
I think that is the highest the doctor can do. And that is why usually when we have radio programs, you call on the governments to also come in controlling this disease. We know that I know that like Yobe state government have enacted laws that prevents couples from getting married as so long as they have a possibility of bearing a child with sickle cell disease. And no imam or pastor
will change that.
Will go ahead.
But
I think it's something that can be encouraged in every state.
Yeah.
Because Nigeria has the highest burden of the disease worldwide.
Yes.
The government
you're right.
Nigeria has yes. So and considering especially our economic situation is also not encouraging, because most patients with sickle cell disease are poor patients.
Yes.
Sometimes you have to give, as a doctor, you have to give out your money out of your pocket, transfer money to go back home for most of your patients. Sometimes you buy folic acid for them, you buy proguanil for them, because obviously there is no way they can get this once they are out of the hospital.
That's what we are doing at our clinic. Exactly what we are doing for the last 15 years. That's what we have been doing. Free medication. So, nobody has ever given us 5 naira to collect their drugs for the last 15 years.
So, and I tell you, a lot of patients.
Yeah, but what the doctor is saying now is that, Hajiyya Badiya, you are carrying so much on your shoulders because remembering your son and you did this to help the poor. And then you have a society where people are nonchalant, or when you are even talking to them, they think you are like you're coming from Mars.
From the beginning, especially.
You know what I mean? So I applaud you, and I applaud His Excellency Governor El Rufai and the governor of Yobe for doing this. I'm hoping many governors will step up and implement this and say that this is a no-no. And I love the idea that you are involving the imam and the pastor, because as you know, I listen to those two. And I think also I would say another step that can help you, the doctors, I think you should also bring these very powerful bodies to be part of your counseling, because
But excuse me,
people may not listen to you as a doctor, but they will listen to their pastor and their imam.
and excuse me, I have one point to give.
Yeah.
If only awareness, the advocacy, if it's spread like it did when HIV came to Nigeria, believe me, by now, because the villages we are just doing it from the city. Inside, nobody knows. They have to see. Let them go to hospitals. I used to explain on interview when I'm having an interview. Let them go and take some pictures of the crisis. Let them go and take pictures of how the parent, or interview them how they suffer. The running up and down. Hospital is your permanent house. And drugs. This less privileged, they don't have. Sometimes, believe me, when they come to the clinic, you pity them. After the first, when we register, they will give them. We weigh their weight. We take their blood samples for some other things like malaria. Because sometimes if they come with malaria this month, believe me, up to the next 4 weeks, they will never take the children to the hospital. No money. So I went to the government Ministry of Health. I begged them. I said, please give me the kit and give me one lab technician so that he will teach one of my staff to be helping them. So already I knew this malaria drug, I know them. So they are part of my, if you go to my office, you see that all the drugs that my children have been using, I have packed them all. If I give them letter to take to any doctor, because we don't keep doctors, there is no use, because we have clinic only twice a week. Having a doctor in the clinic is a waste of doctor's time and also a waste of our resources, which we don't have. So I will always keep what they did or what my children have been using. So I always tell them, because we deal with the less privileged, if by any chance you happen to be in the hospital and they write the prescription for you, please bring it here. If what they wrote is among what we have on our counter, we can give you for free. But if it's not, honestly, you can't give you any money, because we don't have the money. But I always ask people to help us with drugs and also help us with money. We buy the drugs. I have a store here in my house. I used to pack every clinic. We pack the drugs. We think it will be enough for the patients. So every day, if we are going to the clinic, we take our bag and all the drugs, we give them. Already we'll put them in smaller bags. This age to this age, this is how they will take it. They are used to it. All they need to do is to come and collect the drugs from us. I'm so happy that many of them, you won't think they are sickless, because they have been taking the drugs. Every 4 weeks, they come back, collect it, and they will go. If there's any problem, I write a referral letter to a better hospital like Subaroduko, Duse, someone, and so on. They will go there, they attend to them. And we have good relationship with them. Sometimes if they go there, if there's anything, we get out of our account. We help them, like blood and other things, admission, some, because there is no way. Sometimes we can't just leave them like that. They don't have money to buy paracetamol. It's very sad. If they come for the first time, we give them the first drops. Then they will say, how much? Now, okay, now how much? We say it's for free. Believe me, many I have seen, I witnessed so many of them shedding tears.
Of course.
Thanking us for doing it.
Of course.
I wish the government will put hand, all these well-meaning Nigerians, let them put hand so that it will help the less privileged, because we cannot do it alone. We don't have resources. We can't do it, but God.
So at the moment, Hajiyya Badiya, how do you fund all this, the medication and stuff? Because I want you to speak about it. Maybe somebody will be listening here to see how they can help you out. You know, this is the essence about what Dialogue Khuraira is about. Is to
we used to write letters sometimes, or sometimes after any interview, we just put our account, clinic account, or sometimes we write letters, or sometimes I list the drugs. I used to be very clever. If I want the folic acid, let's say I want folic acid, I will write letters to about 3 people. If I want polydrine, I will say to about 2 people. If I want pen leaf, I will ask for, because you can't send the whole list to one person. If he looks at it, this is rubbish. Yes, they are lazy. So by the time they help us, we'll have enough for a month or 2.
Okay.
And some will ask money.
Okay.
If they can assist us.
Okay.
Sometimes if somebody is very bad, I put the picture of the person, and then they will admit the person and they will pay for it, or they will give us money to help them get blood and so on. It's very, very, very sad, honestly.
You know the thing, like when you are talking, you know, when Hanif, doctor, honestly, I tried my best. God knows, I had a meeting with Her Excellency Aisha Buhari and her team at least once, and then 3 times with Dr. Hajo and Hanif's doctor to bring some solution for him to come to the US to bring some solution for Nigeria. He said, I will quote, he said, Nigeria has the highest cases of sickle cells, and that if Nigerian government are willing to work with him, he can actually help in a way that the World Health Organization will even give funding. And I am trying, unfortunately, Her Excellency Aisha Buhari tried her best. It didn't happen at her time. But I am hoping that this government will also like listen to Hajiyya Badiya, listen to the like of us that have the connection, bring this. Because since the World Health Organization had already said that Nigeria has the highest cases of tremendous burden to the health system, not just in Nigeria, but also the world. Because no matter what, this World Health Organization have to give some funding to Nigeria on sickle cells. So imagine that we are able to bring a hub to address sickle cells. Okay, for example, Dr. Cairo was telling me that if there is a bone marrow transplant is brought to Nigeria for those serious cases, and what they are going to do, they are going to train Nigerian doctors. They're going to look at, create the bone marrow transplant center and do all the specification. They are not going to be there. And then being he is a scientist and he's really well respected and the World Health Organization is always tapping his brain, he will help them to find some funding because it is a serious crisis. But to even get that support, it is impossible.
Even now.
Dr. Kasim, what can you tell Hajiyya Badiya today with her organization she can do that can help her get the attention of the highest person that can make something doable? That, of course, awareness is great, but also we need a great healthcare system to help these people that are suffering. Because she sees it firsthand, like you see it as a doctor.
Thank you very much for this question and advice as well. And I think this made me remember when I was in training, postgraduate training in Ahmadu Bello University Teaching Hospital. I think I once accompanied my teacher, Professor Aisha Indomaman, to one occasion in Kaduna. If I remember, Hajia hosted us in one, I can't remember the center, but I think my teacher and mentor, Professor Aisha Maman, received an award that time for her breakthrough in sickle cell disease and so many things. So in fact, I was a bit surprised when I saw that it's Hajia that is really hosting us in this discussion. So I just said, maybe Aisha, Hajia may not remember me as her child when I accompanied my teacher, Professor Aisha, to one occasion.
Oh, so you have met each other before? Yeah.
Yeah.
No, Hajiyya Badiya is a powerhouse when in the advocacy sickle cells. Kudos
obviously,
to her, you know.
Obviously. So
we are almost over our time, and if we're gonna, I think we'll be 10 hours talking about sickle cells. But I think I would want Dr. Kasim to give us one takeaway for parents and one takeaway for the government and one takeaway for the doctor. And then Hajiyya Badiya will close the show for us with what advice she will give to parents and then also kids with sickle cell. What motivational message you will send to those kids or people dealing with this? Sorry if I lumped it all together.
So thank you very much. I think for us doctors, I will encourage us to keep sacrificing, because caring alone, just like we care for other patients, may not actually work very well for sickle cell patients. And one thing I notice, whichever center you go to, you found out that if a sickle cell individual is sick in the hospital, because sickle cell patients can fall sick because they are sickle cell patients. They can also fall sick because they are human beings, just like any other person can get ill. So if they are admitted in other units, you can see that they always prefer their specialists to come and care for them, because we care for them usually more than the other doctors do. So I think I will encourage us to do more. We are doing well, and I will encourage us to do more in caring for these patients. This is actually true because, as we all know, most of them are poor. We said this initially. And even to afford their common routine drugs, folic acid, proguanil, most of them cannot afford.
Yeah.
And that is why we have to applaud Hajia for what she has been doing over decades.
Yeah.
And we pray that the Almighty will strengthen her and her association to do more to this kind of vulnerable individuals.
I pray so
That
too.
is one. To the patients, we keep encouraging you to adhere to rules and regulations, do's and don'ts that are always being taught in the clinics and other advocacy centers, media houses, and so on and so forth. During cold season, protect yourself, wear thick clothing, drink a lot of water, do not subject yourself to excessive stress, take your malaria prophylaxis, take your folic acids, and a lot of this routine that is being advocated for sickle cell individuals. So please, now is, I think, cold season in most areas of the country. So please take care of yourself very well, and so that you don't come down with crisis often and complications later in life. Now, to the government, I will say that the attention that is being given to sickle cell disease is actually low. But I believe this is because we don't have individuals or people that are close to the government and to intimate them and make them understand the burden of this disease in the country, especially when you compare it to the other parts of the world. And being a country that has the highest burden of this, I think there should be a dedicated program in Nigeria for this kind of patients. There should be maybe a unit in the Federal Ministry of Health that is being shouldered a responsibility of caring for sickle cell disease individuals in the country, because our country has the highest burden of this disease, and a lot of individuals are born with this disease annually in Nigeria. Up to 150,000 newborn babies every year with sickle cell disease. So I think any serious government is supposed to look at this thing and create programs to relieve people with suffering from sickle cell disease, especially that most patients are poor. So we'll encourage people, especially that have connections with the government, to really draw attention of the government towards providing a program to ease the suffering and also to control the disease in the country. And for people like Hajia and likes, I will encourage them to do more, because this is the only way for now that these patients get some relief.
Yeah.
Yes, to care for their disease. And we pray that the Almighty will reward her in abundance and create ways to expand her program so that more patients will benefit from these programs. We believe that many patients do not know about her, even though they may be in Kaduna or Kaduna State surroundings. So we pray that the Almighty will give her more and to expand the advocacy as well as the care she gives to this kind of patients. And I will also encourage Hajia and her likes to create more programs, especially in TV and radio stations, because there are still myths and misconceptions about this disease, no doubt about this. Whenever you travel down to villages, yes, there are a lot of myths and misconceptions. Yeah. And this is, as I said, is not surprising because of the society we live in. We can actually be different from the society living in or the society we have been, we have grown in. And this is just typically showing how our society is really in terms of myths and misconceptions or beliefs of how diseases are contracted and so on and so forth. So there is still more to do in terms of advocacy about sickle cell disease, as well as the care of patients with this disease. So we thank Hajia for all her efforts, and we pray that the Almighty rewards her in abundance.
Amen. Amen.
Thank you. Thank you, Doctor. Thank you.
Hajia, what can you say to all your, amazing heroes? Because I call them heroes.
Yes, heroes.
Yeah.
Yes.
What do you say to them and to parents and to also viewers? Viewers that are looking at us, because we are on LinkedIn, we're on YouTube, we're on Facebook, and the network we have of people. I mean, listen to her story. We're going to, after this, we're going to put your website, we're going to put your phone number, for people to reach out, and I hope that you'll be able to get the assistance that you can get. But the floor is yours, Hajiyya Badiya.
Our heroes, I am most grateful to Allah because according to how we are, I made the children to feel we are one.
Yeah.
There was a day one girl came to my office. She was crying. I said, "What is wrong with you?" She kept crying. So I went to the pharmacy and sat with the people giving the drugs. I said, "When you finish crying, just call me." So when I saw her standing outside the door, I was sitting inside. I followed her. I said, "What is your problem?" She said about 4 people came for marriage to ask her for marriage, but somehow it didn't work. Reasons, some of the parents of the boy or his friends or other people, they discouraged them.
True. It does. Yeah.
Yes, it's like that. So when I came that day, I was disturbed. At night, I couldn't sleep well. So a thought came into me. I said, why can't I empower these young girls that have finished secondary school or they are mature and they can do something? At least they can keep, they can look after themselves, because if it comes to school, there is a stigma there. If they finish school, no work, they will say, Sikila, today you will come to the school, tomorrow you do work. No. Marriage, no, we are not going to take. Somebody will discourage you. Are you going to marry a Sikila? Your money will end up in hospital always. It is really bad. So I started thinking, I went to the office, I called my staff, I said, the best way we do it, let's start empowering them. Believe me, within about 2 months, we empowered about 40 of them. We even issued them certificates. We taught them so many things, and we ended up giving them such small amount to start up with what they learned. So it was about the second batch we want to start, then elections started coming. So we said no more. I wanted it to be this January, but with the Hamatan, the little we have, on Wednesday, it was the 6th week, we have been buying and supplying them with warm clothing. I asked people to help me with some money. If they give me, I'll go to Kasum, but it's a big market for second-hand goods. Myself and some staff will go. They will open it. We'll take those one with hood, socks, jeans, sweaters, all. We have been giving them. The patients were so many that up to today, I was in the market to buy more so that we'll finish the distribution by next Wednesday, inshallah. What is worrying me most, all seasons, I don't have a hall where my patients will be for health talk. But inside the clinic, there is admin, there is pharmacy, there is my office, there is a place they collect their drugs, all is there. But always it's a sad affair to see them always sitting. If it's too hot, sometimes they have to remain outside. If it's too cold, the same thing. If it's rainy, the same thing. I don't know what to do. Even the clinic I'm using now is my second son, who is an AA, the second to the one that was late. Believe me, he was the one that, with his friends and my late son's friends, they contributed and built the clinic for me. Before, I used to rent it. So if only I can get a place so that they will feel like home. Outside, even the water, the biscuits, and everything I'm giving to the little ones when they come to the clinic, so that they don't disturb them, get tired. It's outside. There's a road, and for about 4 years now, they disrupt the road that they are going to put Kolka or something. Up to now, I have taken my computer about 4 times for repair because of the dust.
Yeah.
So it is annoying, because they promised. I was one of the first to be promised that they are coming to do it, but up to now there was nothing. But the most important
have you written something to the Antata Foundation, Bua Foundation?
They used to help. They helped us about 2 times.
Yeah.
Within
because
the
Antata Foundation is very.
They helped us. Even when I wrote a letter that I'm going to empower some of the children.
Yeah.
They sent some money. They said after we finish, we take the photographs and send the photos to them so that they know. So very soon we are going to send it, because I think it's almost a year now that it's helped us. But sometimes to reach people is very difficult. And for the well-meaning Nigerians that are rich, please, they should come to help us, because the advice I give them is that if only they can join hands.
You should come forward to the camera, let them see you very well, and talk to them straight in the camera and tell them, come forward. Come up forward and talk to them. Talk to them, they're watching you. Tell them that
like this.
So you need to talk to them, you know.
So if only they will get a testing unit where poor people can take their children. Because if a less privileged has about 10 children, how can he afford to give the money for the test? But if they can do it for free, or they can do it like half the price of the normal price, I think it will help us, because so many of the children will be tested before they get married. I always tell them, before you start anything, any long relationship or serious relationship, go and do your test. I'm going to write a letter soon, because I promised on the television that day when Farumwata interviewed me that I'm going to write, let every child get tested, know their genotype before they start primary school. They should go with their birth certificate and the the genotype, the result, so that they continue knowing they are aware up to the time they finish university. Let's say they go for a party. Somebody will say, please, can I have your telephone number, this and that? You say, what's your genotype? Well, right from there, and they'll forget. No. Let's just be greeting each other. It's not going to work. Please, I think it's going to be a good idea. And also,
it's a very good idea.
Of course, it's very good idea.
The only thing that will stop all this is letting people
awareness.
There is nothing wrong with you being a secular. Okay?
Of course.
You're not going to infect anybody.
Stigmatization is not good.
Secular. You know, there should be
that. Some of these people, they didn't bring themselves into the world. If there is more awareness, people should know about sickle cell. Show the picture, show what is going on, the consequences, how to get about it, how to stop it, how to take care of the unfortunate ones. The government is not helping. They go around to house. I always fight on television or on the radio that they go house to house for polio. When HIV came, they were very serious about it. But sickle cell, at least help the people, the poor people. Let them test the blood for free. There was a time I got free testing kit for about over 1,500 from America. They gave me, so I announced it in the radio, and they started coming to the clinic. We tested them for free. We asked them to laminate and keep. sometimes if they come for the test in my clinic, if they come and say they want to register, I say go for the test. If they bring the test, sometimes I ask them to go somewhere and do it again so that we compare. If it's the same, because sometimes they make mistakes. So I don't want it that way because it will be a big problem in future. Anyway, for the government, let them put hand into what we are doing. Not only in Kaduna, the whole Nigerian government should be very serious because even in Kaduna, not even a single paracetamol, they don't help us with. It's not fair. When they said from 0 to 5 years, there should be a free medication. I had it so many times, but up to now, they are not doing. Anyway, I'm grateful because no matter if it's my own son that is ruling the government, I mean the state, if it's not God's willing for me to get something out of it, I will not get. So that one, I took it for granted. I don't mind. One day somebody will come forward and say, but I'm thankful to the media houses. They are doing it for free. Almost everything I do, if I send them an invitation to come live, they come and they do it for free. So I'm grateful to all these radio houses, media, newspapers, all this, they help us. So the government should put hand. I believe because it's a political government, if any government showed interest in what we are doing, all these politicians that wants to get name, I'm sure they will come forward and help us.
Yeah.
Please, I'm begging. I pity the children. Sometimes we shed tears with each other, with my staff, and some of the. It's very pathetic to see how they are suffering.
Oh yeah.
Please help. The medication, we cannot remove what they have already got, but we can stop what is coming in future. Yeah. Awareness is antidote to sickle cell. So please, the government should wake up and do something for us. Thank you.
Hajiyya, thank you so much. There is no, I don't think there's enough thank you to really show, to even quantify or how you make the community where you are, the people, not just the sicklers, but the family itself. And to the extent that you're using your little savings, your children, your friends, and to find medicine, it's commendable. And God willing, in my own little way, you have me as a partner. We will have to sit down and strategize on how we can do to really get to the top people, to maybe make your organization amplify it. Let people know about it more and more, even if it is like jingles, we have to be sharing. If you could partner with some few doctors where you can do like little what Dr. Kasim had explained, and we can use that and be sending it maybe viral through social media, and maybe that will help us for us to get their attention, and start tagging the officials on Twitter, so that way they can really see, because the media houses can say all they want, but when that politics come, get one politician, immediately one politician endorse it, the other politicians will jump in because they also want to get credit for it. So Dr. Kasim, Hajiyya Badiya, our audience, I know it's very late in Nigeria. I am sorry for taking this long, but this is a very important topic, especially for the voiceless, because like we said, if this disease was affecting the people that are affluent, it would have been taken care of. But because it's affecting the very poor people, maybe it's not. That's the reason why it's not being taken serious. But I thank you, guys. Thank you all for your time, and everyone that Safia Nogogo for your comment, Sani Adamu for your comment, Fasten Fadlan, Tura for your comment, and again, thank you so much, our programmer, Bello Rufai, for making this possible for us. So again, thank you all. And I would say bye-bye to everyone, but definitely we'll stay in touch. I don't know, Kila, did Hajiyya Badiya, I think her network went off. So I'm going to end the show now. Thank you so much, sir. Have a good night.
Bye-bye.
Bye.